I've been asked by a lot of followers at reallifepharmacology.com and the blog at MedEd101 to put together just some basic information about the BCGP exam coming up here in 2022. So I want to highlight what I think is going to be important to plan and prepare. Just as a reminder, I've taken these board certification exams 4 times now, 2 for BCPS, 2 for BCGP, and obviously I get a lot of feedback from folks as well as far as things they were surprised by and things like that. So I'm going to provide some info for you, background on the exam, kind of where I would look to study, and some helpful tips like that. So first off, I want to emphasize the importance here of relaying how difficult this exam really is. Okay, so BCGP, so the Geriatric Pharmacy Certification, the pass rate is 44%. Okay, so you're more likely to fail than pass. And you got to remember, a lot of really smart people are taking these board certification exams. So if you do not pass the first time, do not be discouraged, okay? Stay with it, try again, get some different study materials, develop a new strategy, use the info you gained from taking the exam previously, change things up a little bit, and try to prepare maybe a little bit differently than you did the first time there. So really, really difficult exam, just as far as the questions go, and obviously the grading there as well. So it's important that you take it seriously. I encourage at a minimum 3 months to prepare for this exam. I have had candidates prepare for 6 to 12 months. I think that's entirely reasonable as well. Most, I would say, are in the ballpark of 3 to 6 months. Again, if you work a crazy busy schedule, 50, 60 hours a week or something, and you've got family obligations, you're probably not going to be able to devote that much time per day to studying. So really important that you look at your individual situation as you start to develop kind of your game plan. Okay, about the exam, it is 175 questions, it is multiple choice, and there's only one answer that is correct or most correct. Okay, so there's none of the multiple choice. So if you're somewhat recent within the last several years of taking NAPLEX, you probably remember that the NAPLEX has certain questions where multiple things can be the answer, or select all that apply type of questions. That is not the case with any of these board certification exams, and that holds true for the geriatric exams as well. Question I always get asked, are there brand names, generic names on there? And they typically go with the standard generic names. So if you know brand names really, really well, that doesn't really serve you any benefit. If you don't know generic names or can't remember generic names very well, you might have to do some work on that, because if you're presented something that you don't know, obviously you can't answer that question. But I would say most pharmacists, having years of experience in seeing medications dispensed, or whether you review medications or whatever your work process is, most have become familiar with the generic names there. And then, of course, you've got to take a look at the content outline. Okay, so important that you do that. That's at the BPS website, so go check that out for sure. And I'm going to run through that a little bit here. So there are 3 main domains in the BCGP exam outline. So the first one is person-centered care, and this is 60% of the exam. So doing the math, that's 105 questions. And with this one, probably the simplest, no-brainer way to sum it up, it's mostly going to be your pharmacotherapy. What drug would you select in this situation, and that type of thing, okay? So this could be anything geriatric related. So you think about all the major disease states that medications play a role in helping to manage, that's where your focus should be. And obviously in our study materials at meded101.com, we've really tried to focus on those high-yield disease states where you're going to see the majority of your questions for sure. So with that said, if you're developing your plan, start with the most common disease states. Okay. Now, some of these common disease states, diabetes, hypertension, hyperlipidemia, you're potentially going to be very comfortable in those disease states. And if that's the case, my recommendation is to not totally ignore those areas, but basically go through them quickly. Just refreshing yourself, making sure that you're comfortable with what are the drugs of choice and contraindications and all that good stuff. Obviously, specifically focus on geriatric pharmacotherapy. So, in a patient with diabetes and hypercholesterolemia, you're not really going to care about a 45-year-old, okay? So you're going to be dealing with 65-year-olds, 75-year-olds, 85-year-olds, and treatment may look a little bit different depending upon that age. So think about that situation as you're going through your study materials. Pharmacotherapy, that's going to be your primary focus here. And when I'm looking at drug selection and pharmacotherapy and drugs of choice, I really have two basic thoughts when I'm presented a case, which you're obviously going to be within your exam. One is understand why you would select a medication, and the flip side is why you wouldn't select a medication. So why you wouldn't select a medication, maybe it's got a bad adverse effect profile, contraindications, maybe there's a drug interaction that we should absolutely avoid. Why you would select a medication, well, maybe it's got an adverse effect that's beneficial. Maybe they're not sleeping well at night and it's a sedating medication. Maybe it's guideline-based therapy, it's the drug of choice. So, guidelines, compelling indications, potentially beneficial adverse effects, those are all situations where you would likely select that medication. So that's kind of the easiest way I sum it up for people, is to understand with kind of each drug class, why you would select it or why you wouldn't select it. And then as you're reading cases, you're going to pick up on some of the details that come through in that case. And maybe they have CHF. Okay, well, we're probably going to want to avoid NSAIDs in managing this pain. So I probably know that's not the correct answer. So you look at the other options. Okay, so that's really my major thought process as I'm going in and preparing for these exams. So kind of breaking that down in a little bit more detail. So you're going to look at those case scenarios. So contraindication, compelling indications, guidelines, unique adverse effects, monitoring parameters you're certainly going to want to think about. Lots of drugs that affect renal function or accumulation may happen as patients' kidney function worsen, which is very common in geriatric patients. Genetic considerations, that's kind of a growing area in the field of pharmacy for sure. So, allopurinol, carbamazepine, bacavir, those drugs all have different genetic variations where patients may be at more risk for certain side effects. So, important to think about that too as far as drug selections go. I do get asked about dosing quite a bit by people. The easiest way I say it is I wouldn't study like max doses, for example. If you've been out in practice, if you've been seeing medications dispensed, you're probably pretty comfortable with, what's a pretty high dose of gabapentin versus, what's a low dose of gabapentin. So I don't recommend you spend too much time memorizing specific instant, max dosages, like, is it 2,700 milligrams of gabapentin a day? Is it 3,600 milligrams? What's the max per day? It's like the likelihood that they ask you that is going to be incredibly low. What they're more likely to ask you to recognize is this a high dose? And particularly in geriatric patients, we're worried about that. So just being able to recognize that, I think, is important, and not necessarily have specific maximums memorized, for example. So just wanted to definitely address that question. Now, with specific drugs, warfarin being the classic example, maybe other anticoagulants as well, where we've got different dosing for various indications, whether it's atrial fibrillation or DVT treatment, that type of thing, or DVT prophylaxis. I think that's important to remember, because that's going to guide selection and guide drug therapy, and certainly having that and knowing that dosing is going to be important depending upon what that indication. So again, don't heavily focus on kind of maximum doses and kind of, obscure things that happen. But if you've got situations, enoxaparin, warfarin, other anticoagulants, maybe some of the antibiotic dosing, maybe drugs with boxed warnings. So drug like zolpidem, that's a good example where in geriatric patient population, female population, we might have, a maximum recommended there. Tramadol is another one that maybe has a maximum recommended higher dose of 300 milligrams versus 400 milligrams in patients. So think about some of those things where there's exceptions in our geriatric patient populations. All right, so the next section. So again, pharmacotherapy, 60%. Here's the next section of the exam, principles of aging. So 20% of the exam, 35 questions. So this is a significant chunk, and most of the people, I think, that really struggle with the BCGP exam struggle with this section and the next section. So again, you're going to have a combined 40% of the exam, approximately 70 questions. So it's getting close to half of the questions might not be pharmacotherapy related, okay? So don't be surprised by that, okay? That's definitely something that can catch people off guard. So with our study materials, I think we do, I'm biased obviously, but I think we do a really great job of simplifying these topic areas, but also giving you enough information to be able to understand and memorize some of this information that, in your every day-to-day practice, you might not look at much. So as patients get older, there's financial issues, social issues. You think of caregiver issues, hospice, palliative care, and there's lots of different terminology, ageism, abuse versus neglect, caregiver burnout, things like that. You need to know and understand what this stuff is. You are very, very likely to be asked about this stuff because it is on the content outline. So really, really important to recognize that. Another thing with principles of aging is you want to understand physiology, GI changes, fat changes, muscle changes, all this sort of stuff, cognition changes, all this sort of stuff can impact our geriatric patients, and you're likely to be tested on that stuff. So definitely think about some of that stuff. If you don't use our study materials, you've got to do some research and look this stuff up on your own. Like I said, we've laid it all out. I think we do a great job, better than most other study materials out there on some of these non-pharmacotherapy topics, and we can really be of benefit there in your preparations for sure to help you pass this difficult exam for sure. Okay, lastly, the other 20%. So again, 35 questions. This is population and public health. Primarily, I would focus on statistics here. There are some other topic areas within here that you can certainly get into more detail on, and we have that in our study materials. But first and foremost, I would know and understand statistics. Our statistics-specific study guide will definitely give you what you need to help prepare you to pass these questions, because these can be gimmies. If you know statistics and study design, that type of thing really, really well, like they can be some of the easiest questions on the exam. But if you don't have the slightest clue, which a lot of pharmacists, haven't brushed up on stats in a while, if you don't have the slightest clue what you're doing and some of the terminology with statistics, you're going to be in trouble, and it's going to likely be a significant cause that you don't pass this exam. Okay, other things in addition to statistics. So, you think about how we use medications and medication use evaluations, education, providing education to older adults and different methods, strategies, things like that. Health literacy, the beers, start, stop. So some of those geriatric specific medication concerns that we think about can fall within this category. And then we think about some of the different care levels for patients, from home care down to being in skilled nursing facilities to hospice care. This is all going to occur very frequently in geriatric patients, and you need to know some of the terminology and some of the information behind that. In addition, I would say there's some regulatory things as well. Think of the Medicare program. That's going to specifically apply to geriatric patients. Certainly that falls within this category as well, potentially. So that's certainly something that you could see show up on your exam as well. And again, this isn't an all-inclusive list, but these are just some of the highlights, some of the most important things I think that you should be thinking about. But again, go look at that entire content outline. We've done our best to cover that entire content outline in our study materials. But if you're, not using our content, you definitely got to go through that, and you gotta make sure you understand all the terms and terminology within that content outline. All right, so wrapping up our study materials here, we've got a 20-plus hour review course. Again, we've got all those non-pharmacotherapy things in there, okay? And like I said, my biased opinion, we do better at preparing you for some of those non-pharmacotherapy things better than other study materials for sure. With that said, I feel like we do a great job on pharmacotherapy too, making it as brief as we can, but also you've got to know all about these medications as well. So over 20 hours, like I mentioned, you're going to get downloadable PDF slides with that, so you can take some notes and things like that with it. I got an online question bank, so you can practice up to 1,300 plus questions total with a couple of downloadable PDF practice exams. I can't stress that enough. Go practice questions, okay? You've got to time yourself, okay? You have to do it, because I've gotten emails from several people saying that they did not get through this exam quick enough. And if you don't get to questions, you get them wrong, okay? You get penalized for questions that you don't get to or don't answer. So it's best to prepare yourself to set a good clip. And I recommend usually about a minute a question or less is what you should be targeting. And that gives you a little bit of fluff time to go back through things and things like that. So really, really important point to make sure that you do that. Obviously, the format of our questions is going to be the same as the BCGP exam, so you're prepared and ready for what the questions are going to look like, and obviously covers a lot of the content that's going to be within that content outline. Statistics study guide, I've got lots of compliments from individuals saying, hey, this really helped me pass my exam for sure, as well as that population health, geriatric considerations, and all that stuff too as well within that package. Now, I've got some comparison tables as well. Might be helpful studying tools for you just to refresh on a few things. And then our all access pass, that's going to be the most cost-effective way to prepare. And that's going to give you everything here. If you've got other study materials, or if you're studying off of something else, we do have just the question bank only options So that's an important thing to remember too. If you just want more questions and you feel like you've got enough study materials, we certainly have that option as well. And here are those options. We've got 1 month or 3 month access. But again, for only, I think, $30 to $70 more, you can get access to the 20 plus hours of content, as well as some of the info on statistics and regulatory, those individual study guides, PDF study guides that have been really, really helpful for folks to help prepare them for their exam. In the question bank, you're going to get those 1,000 plus questions that are available online, and then you're going to get those 2 practice exams as well. So it's a pretty decent deal as well, just on its own. But for only $30-$50 more, you can have access to the entire package, which I think is kind of a no-brainer. But if you don't feel like you need it, certainly question bank only with the practice exams is an option as well. Then just finishing up here, we've had lots of successful candidates, lots of great referrals, things like that. So greatly appreciative to those folks who have passed the BCGP exam and have definitely we've definitely played a significant role in helping them pass from their own words here, which you can certainly read for yourself. So something that we're definitely proud of. And I believe, we've added content every year. We update going into 2022. Our materials are ready to go for 2022. And we add, update, edit, make sure that everything's still kosher with guidelines and new drugs that are coming out, and do the best we can to keep that stuff updated, because I know some other study materials tend to have a much longer lag on some of that study materials. So anyway, there's some testimonials there if you want to read them. If you want to reach out to me, you can track me down at mededucation101@gmail.com. LinkedIn is another way to find me, Eric Christensen, PharmD, BCGP, BCPS. And of course, links to our study materials, meded101.com/store, STORE. Go check that out. I'll leave the link in the comments section as well. So hope this rundown was helpful for you. You can definitely pass this exam. It's a difficult exam, but I think it's a really, really important one for those that work in geriatrics, geriatric MTM, long-term care, assisted living consulting, all those type of folks. It's a great certification to have, certainly if you're ever looking to move up in your career or transition to a role like that. Thanks so much for listening, and leave a comment below.